We will now begin our assessment of the peripheral vascular system. To begin, inspect their arms. Notice their size, color, their symmetry, and for any abnormal lesions. Next, palpate the radial artery. And the brachial. This should be equal on both sides. You can also use this time to assess the epitrochlear node. Typically, this is not palpable. If it is palpable, this can be a sign of infection. Next, perform the Allen test. To perform this test, occlude the radial and the ulnar artery. Ask the patient to squeeze and let their hand open and close. Allow the ulnar artery to perfuse the hand. Let it open. If the hand is able to perfuse with the radial artery occluded and the ulnar artery, if the ulnar artery is patent, then the ulnar artery should be patent enough to allow the hand adequate blood flow if the radial artery was needed for insertion of arterial line or something of that nature. Next, inspect the legs. Note their color, their size, their symmetry. Note for any lesions or tenderness noted, any swelling or redness. Also note for any trophic skin changes. Next, palpate the temperature of the feet and the legs. They should be equally warm on both sides. And note any asymmetry in the warmness or the color of each extremity. Also palpate the inguinal nodes. And palpate the pulses. The femoral pulse, the popliteal, and the pedal pulses. The posterior tibial, and the dorsalis pedis. Last, perform the manual compression test. Turn to the side. When the vein is obstructed, feel for a wave. There should be no wave present. This concludes the assessment of the peripheral vascular system.